Hello, ladies and gentlemen. Today I am doing a reaction video of a budget hearing with the Secretary of Health and Human Services, Adam Azar. He addresses several questions about the coronavirus. I'm also going to briefly mention some parts of the hearing that have nothing to do with coronavirus because it's very important that you hear about them. This hearing was 2.5 hours long. I hope you'll appreciate that I dredged through every second of it to get you the most important parts. I will also have some other news clips regarding the coronavirus mixed in. Personally, I'm a little bit less worried that this will become a severe pandemic in America. I think you should be more afraid of the economic damage this will do. You might lose your job for months. So now I'm recommending that you very lightly prepare for food shortages, but you should not spend your rainy day savings. You will most likely need cash more than you will need food if this gets bad. Okay, so we're going to play this first video.
We have only 15 cases of the novel coronavirus detected here in the United States, alongside 3 cases among Americans repatriated from Wuhan, and 42 cases among American passengers repatriated from the Diamond Princess in Japan. As President Trump, Vice President, and I emphasized yesterday, the immediate risk to the American public remains low, in significant part because of the President's decisive actions so far. We're working closely with state, local, and private sector partners to prepare for mitigating the virus's potential spread in the United States because we expect to see more cases here. In terms of identifying cases, CDC has been able to test 3,625 specimens as of this morning. At least 40 public health laboratories should now be able to test using modified existing CDC test kits. In addition, a newly manufactured CDC test can be sent to 93 public health labs as soon as Monday, and there is a privately manufactured test based on the new CDC test that can be sent to those same labs as soon as tomorrow, pending FDA clearance. On Monday, OMB sent a request to make funding available for preparedness and response, including for therapeutics, vaccines, personal protective equipment, state and local support, and surveillance. As the President made clear yesterday, we are open to your views on what levels of spending may be appropriate, and politics have no place in our mutual efforts to keep the American people safe. As chairman of the President's Coronavirus Task Force and working in conjunction with the administration's lead for the virus, Vice President Pence, I look forward to engaging with Congress on that. This year's budget aims to protect and enhance Americans' well-being and deliver Americans a more affordable, personalized health care system that works better rather than just spends more. I look forward to working with this committee to make that common sense goal a reality. Thank you, Mr. Chair.
That said, I would like to emphasize that he has never had symptoms throughout his entire course. He was symptom-free in terms of no cough, no shortness of breath, no fever, any symptoms whatsoever. We spoke with him earlier this evening prior to his transfer, and he actually shared that it was okay to say that he felt perfectly normal. That said, he did test positive while he was in quarantine process in California, and that resulted in him being transferred to a hospital and leading to the serial testing for evidence of coronavirus.
So far, Westerners have had no or mild symptoms. This is evidence that the virus is a lot more severe for people with certain genes, such as the Japanese and East Asians. This is because they have more of those ACE2 receptor cells. We don't know if this is for certain, but this just increases the possibility. Of course, they could just be experiencing extended incubation periods. We will know soon whether or not this virus will be severe in the West, but so far it looks like it won't be, and we can all calm down. The main concern is the overloading of our health system. About 10 to 16% of the infected need intensive medical care outside of the United States. There are only 94,837 ICU beds in America. I don't know how many, but I'm sure a lot of them already have patients in them. So at most, America can safely handle 1 million cases. I read somewhere, and I've searched and searched, but I can't find it now, that the death rate in Wuhan is 7 times higher due to inadequate healthcare. That puts the mortality rate at 14% once this becomes epidemic. I wrote this part of the script a couple hours ago, and the story just broke that the first American death has been reported in Washington, a 50-year-old man, but we don't know the race. So this could be totally wrong. This could be just as bad in the West as it has been in China. We don't know yet, and I'm not leaning either way anymore. I just don't know enough. So, yeah. That's all I have to say about that. We're going to move on to the next video. Here we go.
You can improve health care at the same time you're proposing to cut it by $844 billion. On the issue of the coronavirus, Mr. Secretary, one thing that I'm especially concerned about is that we're running out of isolation wards. Patients with coronavirus need to be held in isolation, and right now they're being sent to wards at acute care hospitals. I know folks in my district are concerned. What are we doing about that?
I actually really appreciate you raising that question. So we are right now in a very active containment mode. And so that means an individual who tests positive for coronavirus, we're putting them into these types of Ebola-like isolation units that will look very extreme. That is not what's indicated medically for these individuals. Most individuals who get this coronavirus will have mild to moderate symptoms, will be able to stay home and treat it like the flu or a severe cold and present at a hospital only for urgent care or comorbidities. So it's really important we correct this impression that it will require this massive hospital isolation for normal patients. We're in containment mode right now to stop any further spread, but if we end up having broader spread, it will be a much more common approach. As Dr. Shook had called it, it will look and feel to the American people more like a severe flu season in terms of the interventions and approaches you see. So thank you for helping me to clarify that for folks.
The administration's latest budget calls for a $3 billion cut for global health programs, including a 53% cut in funding for the World Health Organization. This comes on top of earlier budget cuts that forced the Centers for Disease Control and Prevention to downsize its global health security initiative in 39 out of 49 countries. I want to bring in our guest, Dr. Shata Chak.
Basically, the media is reporting what Trump proposed as a budget rather than what the actual spending has been after his budget was proposed. So while he proposes cuts, none were actually made and the budgets were increased. Trump has strategies for increasing or decreasing budgets. He will make proposals and wait for Congress and others to convince him why those proposals are good or bad ideas. And them reporting it this way was highly unethical. This is how Trump has handled business for many years. It's how most people handle business, and it's a very successful strategy. It's called negotiation. Clearly, with how different the spending is to the budget proposals, the administration is very open-minded when it comes to directing the final spending amounts. I'm just pointing out blatant fake news. Now we can move on.
In terms of resources, there's been discussion about the president mentioning $2.5 billion, some people $4 billion. Chuck Schumer, the senator, $8.5 billion. Where are we at in terms of that? They want to make sure we're going to have the resources if this thing really gets more aggressive. So I want to get your thoughts on it.
So we have proposed $2.5 billion in spending in 2020, so in the next several months, with openness around adjusting 2021 appropriation to fit needs as we see them over the next several months. But the president has made it very clear on national TV last night that he is open to working with Congress on a bipartisan basis to provide the funding amounts that Congress feels it needs. And the vice president's already been working with bipartisan leadership on this.
Let me ask you some misinformation. Mr. Secretary, is it fair to say that the president's funding of the agency has put our nation in danger by cutting life-saving programs like CDC and BARDA?
No, actually, working with Congress, during the president's tenure, every part of our preparedness and infectious disease program activity has been enhanced and expanded. CDC's budget is up $667 million during his tenure. NIH up $7.3 billion. ASPR, our preparedness and response function, up $621 million. Global disease detection, up $183. Pandemic preparedness, $200 million. The strategic national stockpile, up $130 million. BARDA and BioShield, up a total of $275 million for procurement of countermeasures.
But yet, as watching the news this morning, that's not what a lot of them are saying. That's why it's kind of surprising.
Well, what they talk about is budgets, but budgets are like the first move in a chess game with, I'll be honest, a fairly profligate Congress, and the president starts that move with a budget, knowing that we're going to get a lot higher there as we work with Congress.
The other
in terms of getting a handle on this, but my understanding is only 5 states' labs have received tests so far. Kits. My state hasn't, in the state of Connecticut. How soon can they expect to get those?
So CDC invented a diagnostic within, I think, a week of getting the sequence from China. It has 3 steps to it. They probably, in retrospect, maybe over-engineered it a bit. We, at CDC, have done over 3,600 tests there. We have had no backlog. We've added staff, et cetera. We shipped to all of our labs the test once it was approved by the FDA. What we found was that in some labs, the 3rd step of that, they were having trouble with getting a quality control validation on that, so it led to inconclusive results. We now, as of yesterday afternoon, the FDA authorized the use of those tests by using just the first and second step, provide a definitive diagnostic. So 40 labs are qualified to already be doing that. And then by this weekend, all 93 labs around the country that get these will have either CDC or on Monday, will have the private sector, or on Monday, a modified test that's even easier.
How about in the case of hospitals? Will hospitals be giving the same? A number of doctors and hospitals in our major cities have raised questions with respect to this. How would you respond?
Yeah, so that's the next step, is working with the private sector and also CDC to develop basically a bedside diagnostic. So that's really the next step we've got to get to. And I think
Ballpark timeline with respect to that?
I try not to make predictions about medical technology, but we've got, I think the commissioner told me as many as 70 possible diagnostic makers are looking at how to get this up and running at the bedside.
Well, that's encouraging to hear, but I know from talking to a number of the docs in the hospitals, the sooner they're able to do this, obviously, the better. But I thank you. I just would add, only as a comment here, and given the bipartisan nature, our dear colleagues on the other side of the aisle, when they, for 8 years, had the ability to modify the Affordable Care Act, but they said they were going to replace and repeal it. And they did very little other than weaken it. So it's heartening to hear that we're going to be pulling together to strengthen that in a way, and especially in this time of crisis. And thank you for your service.
To deal with situations like a pandemic. There have been fluctuations up and down, but from 2017 on, it appears to me that this administration has targeted the very programs that provided the sort of infrastructure that would help us respond. And looking at the modest adjustments in what you call an opening bid belies what this administration has done since it's been in charge. And I would appreciate having an opportunity to flesh out, comparing apples to oranges, what's happened over the 3 years that we've watched this stewardship. I appreciate your help.
Thank the gentleman. With that, let me recognize the gentleman from New York, Mr. Reed, to inquire for 4 minutes.
Thank you, Mr. Chairman, and thank you.
All right, so Mr. Blumenauer used his 4 minutes of time to spread fake news. He spoke as slowly as possible to ensure that Adam would not get the opportunity to respond to his so-called questions. He asserts that the Trump administration cut the CDC program's budgets dealing with pandemics. And this was already resoundingly refuted in the beginning of the hearing, so let's make this clear. The CDC has never lost funding due to the Trump administration. That's it. Okay.
But like Mr. Buchanan, I too had a telephone town hall last night. 1 out of every 3 caller in was talking about the coronavirus. So certainly the concern, if not the fear, is starting to permeate throughout our communities and throughout the country.
So it's really sad that the world has been left this terrified of the virus. All the fears of the virus could be easily quelled with some basic cheap testing, as I stated in my last video. Last time I asked Victor, the famous virologist, why don't they just test to see if the virus can infect cells other than the ACE2 receptors, specifically CD4 receptors of the T cell, which would make the virus like HIV. If they can prove it can only infect up to 2.5% of your lung tissue, wouldn't people be a lot less afraid of it? So, I mean, I'm sure there's a reason why they're not doing that, but I would really like to know. So, I mean, at least just do the HIV test, because there's been enough speculation, even scientifically. There's been a few more papers that have come out in preprint of them talking about this HIV connection, and it just seems like a no-brainer to at least just test it on CD4 receptors. Just test it on that. But no, they're just going to let, the economy collapse instead of doing a test that probably costs like $100. Okay.
And we do face, I think, some unique challenges in the rural providers' fear of how we address the spread of this virus. How confident are you in regards to the infectious disease protocols that we have in place with our rural providers right now, that they're up to the task of what's appearing on our doorstep already? With 47 countries, we have the first known non-origin source detected here in the United States. It's coming, and I'm concerned whether we're ready for that.
I think it's a very fair question because, one of the bedrocks of our system is our great hospitals, our great public health infrastructure, and our providers. That's how we're identifying these cases. Of the 15 cases that we've had here in the U.S. that weren't imported from repatriation, all but one of them came from great doctors and nurses identifying symptoms and testing. I worry about infection control protocols in rural facilities. Just they don't see it as much. And I do think we're going to, and perhaps the funding through the emergency supplemental can help with that. I think we have to up the game nationwide around immediate infection control on suspect cases so we don't get nosocomial infections.
Well, I would also encourage the administration to really take a forward stance on the protection of our frontline rural health providers, the provider community overall, because if they start getting infected and start going down, then we are going to be in a world of hurt. And likewise, how confident are you about the infectious disease protocols that we have in our schools? I mean, China now is shut down. Japan just announced they're shutting their schools down. South Korea, soon we're probably going to see it in Italy and sweeping through Europe. Are we ready at the school level to protect our children?
Yep. So at the school level, it's like at the employment level. The most important thing one can do is if you're symptomatic, if you're not feeling well, you need to stay home and not go to school. You need to not go to work. It's really, Dr. Schuchat spoke about this yesterday at the press conference. It's the same basic public health protocols for the common cold and for the flu, which is proper hygiene, washing your hands, covering your mouth, not touching your face with unwashed hands, and staying home if you're sick. And we need schools to enforce that. We need employers to enforce that. It's also important we don't over-scare and have people walking around with masks on. And that's not what we recommend. That's not the safe way to deal with things.
Well, one thing I'd recommend that you take back to Vice President Pence and the task force that's now formed is for us to start developing a strategy for online learning opportunities. Because, man, when this stuff starts spreading throughout the country, the natural reaction of parents will be to bring the kids home and try to protect them and take them out of school. And we can't afford as a nation to have them sitting at home without any course instruction in front of them for months at a time or however long it's going to take for us to get a grip on this. So, and then being uniquely concerned about those kids at home who don't have broadband access. We aren't going to have those same online opportunities as others' children. So that's one recommendation for the task force to look at. Thank you, Mr. Secretary.
Thank you. Let me recognize the gentleman from Missouri, Mr. Smith, to inquire.
Thank you, Mr.
All right, so it's really annoying that he didn't answer the question. Does the Trump administration think that schools might be shut down? We had a few announcements from the CDC warning us about this, but we still don't know if the actual president thinks it's likely. So thanks for dodging the question, Adam.
This administration is not prepared for the global outbreak. Many of us are. We're not going to sit back and simply say it's in somebody's hands. We all have a responsibility here, especially when we hear the news of the first person-to-person transmission on U.S. soil. The president is tweeting about the stock market. Senior officials are lying about containing it, and I don't see a plan to manage the risk. So we sent a letter last week highlighting the concerns about the risk to the medical supply chain due to global dependence on Chinese manufacturing. Do you plan to ask Congress for additional appropriations, as public health experts have suggested? And what do you think about that supply chain? Does it have serious problems as far as you perceive?
So we do have a real issue in terms of the supply chain being bound up so much in China. There is one bit of good news from our survey that FDA did. There are 20 products that are either whole or with a single source active ingredient sourced out of China. So 20 of them, there's no alternative in that sense. We're aggressively monitoring, working with the industry. We're not aware of any potential shortages yet, but with device and pharmaceuticals, we're very much on the lookout for that and working to find alternative sites and supply chain.
Thank you, Mr. Secretary. Thank you, Mr. Chairman.
Thank you.
So medicine shortages are my biggest concern about the virus. Most of our vital medications, including insulin and antibiotics, are manufactured in China. The United States putting our biggest enemy in charge of our medicine should be considered high treason, and whoever did it deserves to be shot. That being said, it is what it is. Now what will happen during this pandemic? All I can say is it's good and surprising news that they don't have any inclinations of shortages yet. I don't know how much I believe that, but at least, maybe that's true. This is the most serious problem caused by the pandemic, and I will continue to monitor it.
And Democrats, as you've already spoken about, to lower pharmaceutical prices. My fear is the unintended consequence that by doing that the high risk, high reward, small biologics, small molecules, even genomics that don't exist in those markets, that scarcity is going to be re-imported here. They're about to wipe out small pharma and functionally protect big pharma, because they just wiped out the capital stack for all the small pharma companies that are creating the disruptions. Am I wrong? Tell me, am I seeing it the wrong way?
So I would be a bit balanced on that in that, of course, the President and I have been very supportive of notions of reference pricing in Part B, where we are a price fixer and price setter, and we just do it pretty stupidly at 106% of average sales price. In Part D, though, where we actually have competitive marketplace that supply and demand curves are meeting to produce market competitive pricing for the most part, except in some areas where they've been precluded from negotiating, that system really does work, and a system of reference pricing or price controls beyond that could lead to some real distortions in the system, as you said. And we also, H.R. 3's so-called negotiations, it's not clear how implementable or practical those really could be as crafted. We want to work with Congress on a system to get prices down, but it's got to be practical.
Have the Democrats that care about drug pricing, have they been reaching out to your office and trying to come up with a method that actually would work without killing people because of the future curative drugs that will disappear?
I'm not aware of that outreach with my office. I know there's been White House interaction with the Speaker's office, but we want to work on a bicameral, bipartisan basis. You know, we've got the Grassley-Wyden package in the Senate is one that is proven bipartisan. That's one example of how we might move forward. And real reform to Part D could bring huge benefit to our seniors.
So I'm hopefully you're hearing, we all have the same goal. Some of us are very fearful that if we destroy those disruptive curatives, that 5% of our brothers and sisters that have chronic conditions that are the most of our healthcare spending, we lose that cure that, you know, the single-shot drug that cures hemophilia and these other things that are coming here. There's one other, and this one's a little tougher. Like, I have a series of alerts on just tracking testing for the virus. Here's a company out of Israel that just announced they think they have one that within 25 minutes could do desktop analysis on the drug. What do we as policymakers have to do to functionally legalize healthcare technology? The thing you blow into that could tell you have the flu and order your antivirals, except that technology today, because it's an algorithm writing the prescription, is substantially illegal. How do we work with you to actually do the technologies that could crash the price of healthcare?
We work together. Thank you, Mr. Secretary. Thank the gentleman.
Thank you, Mr. Chairman.
With that, let me recognize the gentleman from Texas, Mr. Doggett, to inquire.
Okay, so this was my absolute favorite question, and I was disappointed by the answer, which was no answer. It was 3 words. First, he briefly mentions that our efforts to lower the cost of drugs could greatly impede innovation. Controlling the cost of medication is a form of socialism. The number one consequence of socialism is the halting of innovation and the destruction of small business. I believe in a mixed economy that balances innovation and affordability while allowing for the most amount of freedom as possible. This is basically what we have now. Our economy is mixed, it is not 100% capitalist, and it's certainly not socialist, and it shouldn't be either. Yes, drug costs are too high. However, telling companies what they can sell their drugs for isn't the best solution to the problem. This just highlights that issue. Under a president like Bernie Sanders, we would get complete socialization and all innovation would completely stop. Innovation is what gives America the upper hand in the international economy. We've become just like everybody else without our innovation. Bernie Sanders wants to eat the rich, using the wealth tax to get rid of billionaires. First off, all our corporations would simply be bought by foreign investors. Our programs would get funded in the short term, but it causes more problems in the future. All these billionaires would sell off their stocks to foreign investors and give that money to the government. So the government would get money in the short term, but now that money is gone forever. So basically, it turns us into a third world country. Just like how we own many of the factories in China, foreigners would own many of the businesses in America. It's already happening. This would accelerate it. There's an alternative here, and he succinctly highlights it. The alternative is increasing efficiency of healthcare everywhere possible in every way possible. We have the technology available to do this now. It's just that there's red tape in the way. Instead of having doctors do things that machines can be doing, they can focus on everything that a machine can't do, or a computer. More complex treatments, research, and development. Can you see how this fundamentally frees up their time and makes healthcare more affordable? Nothing about taxing the rich fundamentally frees up time and resources. That's why it's not a solution. It's just lazy and low IQ complaining. So my hat's off to David S. Schweikert for proposing an actual solution to the unaffordability of healthcare that doesn't lead to unnecessary deaths. Now he is on my list of politicians to watch.
Her name.
Dr. Nancy Messonnier runs the respiratory and influenza branch, yes.
And was it your decision yesterday to exclude her from the press conference on this issue?
No, we actually had her boss, the senior career official, Dr. Ann Schuchat, was at the press conference.
Yes,
she was
you
up
did,
here.
but not the respiratory disease expert who was the truth teller, not unlike Dr. Lee in Wuhan, who spoke out on Tuesday, apparently drawing the president's attention in saying we will see community spread in the United States. It's not a question of if this will happen. It is a question of when and how many people in this country will have severe illnesses. Do you agree with her statement?
First, I know Dr. Messonnier extremely well over decades. I have the highest respect for her, and yes, we believe there will be. No, it's very because we have to be careful with the public.
As you know,
Community
time is limited.
spread.
Do you agree with her or not?
There is context needed. Community spread could be in a town, a locality, or could be nationwide like China.
It could have begun yesterday or day before in Northern California.
In fact, this
Let me ask you as
15th
well,
case could be a community case. We
as
don't
you
know.
know, in saying disruptions to everyday life may be severe, but people might want to start thinking about this now. Do you agree with her on that?
That was a statement of a range of possibilities, which is,
Yes, sir.
yes, we're dealing with a pandemic. There are elements
really
that
the
could be
question is
severe.
whether or not the administration is moving based on this serious concern or just on putting a happy face on all this that'll go away when the spring flowers come out.
That's a
And I
complete
want to pursue with you
misrepresentation.
what some of the specific things the administration is and is not doing in that regard, beginning with the question of face mask. I'm sure you saw the story that the N95 mask that is important to those who are healthcare providers, that many hospitals only had a week's supply. What is the administration doing to assure that there's an adequate supply of those masks?
We're asking you to fund us buying masks.
I see. So we don't have them now, and 60% of large chain pharmacies also say that they've run out of masks for the public in general. On the question of lab tests, as you know, last Friday, the Association of Public Health Laboratories said that only 3 states had the capacity to test people for the virus, and in the case of what might be the first community spread in California, it's taken 4 days to determine whether that person had coronavirus. I've had this experience in San Antonio, where for anyone to determine whether those people that came off the ocean liner in Japan who are now at Lackland Air Force Base, we have to send the test off to Atlanta to get an answer on that. A problem about not testing people on the base, transporting them across town. Congressman Castro and I wrote you about this back on February the 13th. Despite numerous calls, requests, it's been difficult to get any answer about the specifics on that, though my staff advises that finally in the midst of this hearing, some message came through from you about that. Our localities, even considering trying to put people in recreational vehicles to keep them separate if they have the coronavirus in full. The city of San Antonio has not received any reimbursement for these matters to date. It's unclear to me whether the administration has in place a plan to send extra reimbursement to localities faced with a problem. The ineptness with which the administration has approached this problem is not only serious, it can be deadly if not changed in the approach.
Thank the gentleman. Let me recognize the gentlelady from Indiana, Ms. Wolarski, to inquire.
All right, well, that was pretty annoying. So you can tell a politician is shit if they complain more than they propose solutions, like this guy did. Significant disruptions to daily life are no longer likely, in my opinion, unless things change with the condition of Western patients. And obviously that just did, so who knows? But preventing this won't be worth the destruction of the economy. That doesn't mean we get off scot-free. My fear with this is that these coronavirus diseases increase in number and return annually. This will basically make conditions such as HIV and even diabetes completely lethal. It could also reduce the life expectancy of mankind to 60 to 80 years instead of 80 to 100 years, and increase infant mortality drastically. These consequences seem like they will be inevitable. It sucks, but it probably isn't going to happen completely for a few more years.
That would require massive new taxes on workers and families. Secretary Azar, can you talk about the financial impact for Medicare for All and what kind of impact it has potentially on seniors and middle-class Americans that I serve in Indiana 2nd District?
It would be absolutely devastating. We've got 180 million Americans who get their insurance through their employer or more importantly, their union. Their insurance would be taken away. Collective bargaining rights that they have given up in exchange for insurance would be taken away without compensation and wages. For our 60 million seniors in Medicare, a third of them depend on private insurance, Medicare Advantage, the ever more popular private option with added often dental, vision benefits, and pharmacy benefits for them, taken away as part of this. It would be devastating for America's seniors.
And let me ask you this. The rising rate of maternal mortality across the country is something I've been extremely concerned about, and I'm
Thank you, Adam, for making the consequences of this program clearer. Turning the system upside down will not decrease cost. As Mr. Schweikert pointed out earlier, only increasing the efficiency of healthcare will decrease the cost of it. Anything else will just devastate us.
Researchers, medical personnel that were put in place by this administration and under your leadership gave confidence to the country. I know he mentioned, talked a little bit about community spread. I wonder if you could just comment on that for a second.
Thank you, because I do think that exchange could unnecessarily worry the American public. When we say, when the CDC says, I say, the President says, that it is quite likely that we will see more cases and quite likely we will see community spread, that could be in one town, a locality, it could be in a neighborhood, it could also be nationwide. We say could. We have to prepare for all eventualities, and we have to educate the public about the potential for eventualities. That does not mean they will happen. It means we, responsible stewards, prepare for them. We have this 15th case in California that could be a potential first community spread in the United States. We have to now do the epidemiology behind that. We have been consistent from day one about this messaging across all levels of the government.
Thank you for that. Thank you for.
It was funny because I was watching this hearing last night and more stories of the community virus spreads were happening, like this one.
Thank you, Kathy. As Dr. Lofi mentioned, we do have a new case of coronavirus in Snohomish County. We've received a presumptive positive result from the state lab today for a school-aged adolescent. This individual became ill on Monday with fever, body aches, and a headache. They were seen at 2 different clinics, both in Snohomish County, over the course of the week. As the student was feeling better, they did attempt to return to school at Jackson High this morning. The results came back and the student was promptly notified and returned home before attending class. The individual is currently in home isolation as well and is doing well. There was no travel history associated with this case. Our team is still in the midst of the contact investigation, so we do not yet know the possible source of infection. Our staff have notified a very small number of students who came into close contact with the individual, and those
tools to decrease the risk. We can't 100% stop this virus from spreading. It's probably going to become an annual virus like many of the other coronaviruses at some point. We will become immune to it, more immune to it as a population. It won't cause huge outbreaks in the future, most likely. But this is the first time, and most people don't have immunity. So we need to take these special steps. So the idea is, don't panic, be prepared, because there are things you can do to reduce your risk. The steps that we've mentioned, and the measures that we are taking shouldn't scare people. The measures that we are taking and may recommend are to help.
So he thinks it will get better as time goes on? Well, that's encouraging, I guess. All right, so this chick.
It's cutting $181 billion from SNAP over the next 10 years. There's also a $500 million cut to the Supplemental Nutrition Program for Women, Infants, and Children, otherwise known as WIC. And in 2016, 41% of WIC participants were Latino. So the administration, through these devastating cuts, is actively making it harder for millions of Americans to receive help with something as simple as putting food on the table. And I might remind you that 1 in every 5 SNAP recipients is a military family at that. I'm not sure what your values are, but back in the district that I represent, we don't believe in letting kids go hungry or those that are in need go hungry. A country as great and as rich as the United States of America should not see food insecurity among its population, and slashing the budgets of vital programs that provide basic necessities to human beings in this country, those programs should not be on the chopping block. But I guess I shouldn't be surprised, though, because this is the same administration that puts children in cages, so I could see how food might not be a priority for them. Where I come from, people's actions are worth a lot more than what they say, than what their lip service is. President Trump, in his State of the Union address, said, and I'm quoting him directly, "I've also made an ironclad pledge to American families. We will always protect patients with pre-existing conditions, and we will always protect your Medicare." Does President Trump's budget protect patients with pre-existing conditions, people who have cancer or diabetes?
It absolutely does and will ensure the protection against pre-existing conditions. The problem is the Affordable Care Act doesn't actually do what it says it does. When
Well, I'm going to stop you right there because the president's budget doesn't protect seniors or people with disabilities on Medicare. It's fascinating that the president's vision for health care requires an $844 billion cut to health care. I'm going to say that again, $844 billion cut to health care. Again, actions speak louder than his empty words. If he wants to protect people with pre-existing conditions, why is this administration arguing in favor of a lawsuit that would do the exact opposite, and that's take away protections for people with pre-existing conditions? My district has over 300,000 non-elderly people with a pre-existing condition. Why is he trying to mess with their health care? These sabotage attempts to our healthcare system and our immigration system are hurting and scaring millions from getting much-needed medical care. So as much as you want to stand up here and defend the president, this administration has made it more than clear on where they stand with the American public. This budget is not fair for hardworking families in my district or for families across this nation, and nothing that you can say reverses what the actions show. Thank you, Mr. Chairman.
Thank the gentlelady.
I yield
Let
back.
me recognize the gentleman from New York, Mr. Higgins, to inquire.
Thank you, Mr. Chairman. Mr. Secretary, on Monday, January 13th of this year, President Trump, in a tweet, said, and I quote, that I was the person who saved pre-existing conditions in your health care, end of quote. How did he do that?
The President is going to ensure that any health care reforms protect pre-existing conditions, unlike the Affordable Care Act, where a 55-year-old couple in Missouri making $70,000 a year and are unsubsidized would pay over $30,000 a year in premiums and have a deductible of over $12,000. That's a meaningless insurance card. That's not actual protection of pre-existing conditions. He's the one committed to actually doing that if Congress will work with him.
And concurrently is trying.
What an annoying old hag. Again, using all of her time to try and spread fake news while not giving an atom chance to respond. Trump has submitted a budget proposal. He has not cut SNAP and WIC. He has proposed cuts. That's what he promised to do if he got elected. He would propose them and he would negotiate with the other side whether or not actually doing so is ethical.
So let me go again to the budget. Medicare gets another president's budget. Medicare gets another 25 years of life under this budget, and Medicaid grows year over year. Let me point out that there's more than one body in this government that we have. And budgets aren't law, they're a template. And you can rant all you want, but I find it interesting to complain about the president's budget when there is no House budget. Present your House budget, and that's what drives the conversation. So I would be hesitant to be too critical of the president's budget if you don't have one yourself to make the recommendations. It's easy to criticize, but it's better if you have your own solutions. Mr. Secretary, I'm glad to see you here and that you're going to focus on rural health care. That's very important to me, as you are probably.
Thank you, Mr. Winstrup.
Producers first, put America first. We've reduced the tax burden. We've removed some of the unfairness, like with respect to the death tax. People literally sell their family farms that are handed to them because they can't afford to pay the taxes. We've reduced unnecessary and ridiculous.
I just wanted to play this clip really quick to bring up death taxes. People don't understand that when they put in a tax on an estate after death, they aren't just taxing horses, limousines, and private jets. Family-owned farms for hundreds of years were forced to sell them to pay a 30% tax on their value following the death of the parent who owns it. So if a farm is worth $1 million, then they needed to pay $300,000. They didn't have $300,000, they had to pay the farm. They had to sell the farm. So Bernie wants to do that to more people in the future. To Bernie, you aren't a person. What your family did doesn't matter. You don't matter. You are the same as everyone else. You can't own or build anything ever again. That's all.
Work with Congress on a bipartisan, bicameral basis to secure additional monies such that Congress sees fit. I did want to mention, it is not part of our doctrine for pandemic that we would be using mandatory institutional quarantine like we've dealt with in Chicago there. That's unique circumstances of federal quarantine from these passengers coming in from out of the country in this active containment period. So it would not be part of the expectation for Americans that you would see this. It would be home isolation is really much more what we would do.
The case in California, is that person in quarantine? Or is that
because we are still in an active containment strategy, which is to put people into mandatory quarantine. At some point, if we were in a mitigation mode, people will stay at home, just like with severe flu.
Okay, so, and just for the sake of time, my constituents in general would feel more confident if we were preparing to protect us against the worst case, if we're asking for all the funding and never had to use it. But you're not, which is, I believe, unnecessarily putting our communities and our nation at risk when lives are at stake. And we also have to, and this may be a question you need to answer separately, deal with the logistical issues like supply chain management. With stockpiling, we need to be dealing with today, not tomorrow. Can you provide us with concrete examples of how the agency is preparing for shortages in supplies like gowns, masks, et cetera, and what you've done so far, and what you plan to do in the future to make sure we have things placed where we need them, when they need them, as they need them?
So we're already using on the transfer and reprogramming money to initiate contracts for gowns and as well as N95 masks, and with the emergency supplemental funding that we hopefully will get, we will acquire massively more amounts of that, but we've started the seed contracts so we can build on those quickly.
My time is up. I yield back.
Thank the gentleman. The gentleman from Kansas, Mr. Estes is recognized.
So to summarize, Trump has not cut the budget of the CDC, WIC, SNAP, Social Security, or Medicare. He has made proposals to negotiate budget cuts with. In the past, these proposals did not lead to any budget cuts whatsoever, so they most likely will not again now. I have read all the political books Trump published before he ran for presidency. Every time the subject came up, he made it very clear that he thinks seniors worked hard and earned every cent of their Social Security and Medicare. He doesn't see them as welfare, but as hard-earned retirements. He also is aware that they are a Ponzi scheme scam. We all know that the Social Security is going to go bankrupt in the next 50 years. He's taking steps now to mitigate that. Regardless, he has made it clear that he will do everything he can to protect senior citizens' Social Security and Medicare. The mainstream media is being very dishonest when it claims that Trump doesn't care about this issue. That's not true at all. It's just a very bad problem that he inherited. Coronavirus is currently in a strict containment phase, where extreme measures to isolate a person are taken if they are found to be infected. If, and most likely when, the virus becomes more widespread, these measures will cease and in-home quarantine will be used instead. A 14-day quarantine costs the government an average of $10,000 a person. Personally, I see this as a huge waste of money because the outbreak is most likely inevitable and in-home quarantines will have probably been just as effective. It is still possible that COVID is a racist virus that will be less infectious and lethal in the West. However, while I was making this video last night, 2 news stories broke of other community-spread infections discovered. There have probably been more by now, but I've been too busy working on this video day to find out. Finally, the story of the first death was reported about an hour ago in America. We still don't know the race of that victim and can't draw any conclusions from that yet. We probably won't ever know the races of any of the victims, so thanks again, stupid outrage culture. Now, I must interject again into the script. My husband just told me that there was another death of an English, I'm not sure if it happened in English, but an English man who was in his 80s, and he was white. But he was in his 80s. So I never said that the whole ACE2 receptor thing means that, like, it can't kill, like, people that are incredibly vulnerable that are white. So until we get a report of, like, a 50-year-old white person dying of coronavirus, 30 to 50 years old, then, like, that whole ACE2 receptor theory is still up in the air. The 50-year-old also had, the 50-year-old American, he had a pre-existing condition. So we don't really know for sure yet until we get, like, we can't just say, like, oh, if this one case happens, then we know for a fact that it infects more cells than the ACE2 receptors. It's going to take a lot of cases to come up before we really know if this is more infectious and lethal in America than it has been in the rest of the world. So we're very, very on the cusp of that, and we really don't know yet. And as far as I can tell, I can't even tell you. I spent 5 hours last night on Twitter trying to find out what's going on in Wuhan, and I could find nothing. I found one report of a woman, there was a lady that that saw people getting burned alive. They were being, what's it called, burned alive? Whatever, funeral burned alive. And that there was that, and then there was like another one where they said that the cities the quarantine got lifted for 3 hours and 300,000 people that could have been infected escaped into the rest of China. There was like this weird, obscure story on that. And other than that, I couldn't find anything. Oh yeah, and then one of the people, I'm following several Chinese accounts on Twitter, and I go through all their posts, and they just haven't been posting anything because they don't know anything. And I went through all their posts, and the only thing I found was one of them said that his contacts in Wuhan had shut off, so he was no longer able to communicate with most of the people in Wuhan. So I don't know if that's true. I don't know if it's getting worse or better in China because, like these Twitter accounts, there's only like 20 Twitter accounts that I'm following, so it could be anything. We don't really know what's going on in China, and people in China don't really know what's going on in China. People in Wuhan are locked in their apartments for the most part, so they don't know what's going on, and, people outside of Wuhan that are contacting them don't know. So we don't really know what's going on there. We don't know how bad the infection is or anything like that. We don't know if it's getting worse or better. According to official numbers, it's getting better, so we'll just see. So going back to the summary, it's definitely an enigma for now, but the truth will become rapidly apparent in the next few days if breakouts and severe illnesses start to occur. So right now, you need as much money in savings as you possibly can. Can you afford to not go to work for 2 weeks? What about 2 months? If you get quarantined, how are you going to pay your mortgage and bills? These are the most likely problems you will face. So I go against the narrative. I don't think you should focus on buying food. I think you need to save as much cash as possible. You should buy basic staples that can get you by if you don't have access to food for a few days, like rice and beans. If you can afford savings and food, you definitely want to do both, but if it's one or the other, prioritize saving money. If you can't afford to buy food, look up local food drives. Usually local churches do a free, no questions asked food drive once a month or so. You can just go to their parking lot and pick up free food. I recommend calling your local Catholic churches and asking them where and when food drives will be occurring. It might be more difficult now that the crisis is basically at our feet, but they might still be available. Finally, Medicare for all is a terrible concept. Did you know that private insurance companies aren't allowed to profit more than 6%? It's highly unlikely that bureaucrats will cost much less money to do the same jobs as insurance agents do now. We can't cut out the middleman and significantly reduce costs. We can socialize medicine and standardize payments for all medicine and services. Basically, the government tells everyone in the medical industry what they can charge. However, that can be done without getting rid of private insurance companies. The Trump administration is already taking steps to do that. For example, he just made a rule forcing hospitals to advertise the actual cost of services. Turning the system upside down will cost a huge amount of money, and in the long term, it won't reduce true costs at all. The only way to reduce the cost of healthcare is to use artificial intelligence and technology to make it require less human labor to administer. This is obvious to anyone who's put any thought into this. Yes, the Democrats are aware of this, and that this is the only way to make healthcare affordable. Democrats want Medicare for all instead because they are childish, power-hungry tyrants. They use Medicare for all as a talking point to get more people to vote for them. They probably have no intention of actually installing it. If they do, that means they are even more tyrannical than I can imagine. Bernie Sanders praised Cuban dictators because he has every intention of becoming a dictator. Actually, we will see who he wants to be dictator of America based on who becomes his running mate in 2020. Anyways, I've ranted enough for now. I will do a video on why eating the rich is a bad idea that won't work in the future. That's it for today. In closing, I might change my username on here from Tucker Parrott to Deleted C. So if my channel disappears and you suddenly see Deleted C, that would be me. I'm not sure if I can do that. I think I saw that I can. I haven't looked into it, but if I can, I'm going to. So that's enough. I don't know how my videos can end up this long. I don't know how I spent 12 hours on this video. I don't know what's going on. So I'm done. Bye. See ya.